Hello everyone, welcome to my YouTube channel. My name is Nurse Valerie. I'm a registered nurse midwife and a certified family planning care provider. Yes, this channel I talk about pregnancy, I talk about labor, I talk about maternal and child health tips, I talk about family planning, productive health, and everything about the girl child, everything about the woman. So today I will want to continue from where I stopped. I started a topic on vaginal yeast infection, of which I explain what yeast infection is and the causes. Please, you can watch it on my video. Yes, you can go through my videos. At the last video before this one I'm posting now was I discussed extensively on the causes of vaginal yeast infection. So today I just want to talk about other causes of vaginal yeast infection and elaborate more on the signs and symptoms, the prevention and treatment of vaginal yeast infection. So if this is a topic you're interested in, so stick with me to the end of this video. Like this video and subscribe to my YouTube channel. Please stick to the end so that you know the treatments of yeast infection. It's just with over-the-counter medication, over-the-counter drug can help you get rid of yeast infection. So let's get started. Okay. In my previous video, I listed that some of the causes of vaginal yeast infection include misuse of antibiotics. Yes, antibiotics misuse, pregnancy, of which I said that sometimes pregnancy can, trigger you to have vaginal yeast infection. Then I talked about birth control pills. If you're taking birth control pills, most times you can, find yourself having some vaginal yeast infection, of which I discussed extensively why you will experience yeast infection, why if you're pregnant or taking birth control pills. Please watch the video. So other causes of vaginal yeast infection could include diabetes. If you're diabetic, most times you experience yeast infection. Yes, you may not know that you're diabetic. Most women doesn't know that they are diabetic. So sometimes due to the excess sugar creates room for the yeast to strive and outgrow, because in the vagina, the normal flora that lines the vagina, there are yeast. And this yeast infection is caused by an organism called the Candida albicans. Sometimes it's called candidiasis. So now the normal flora in the vagina, what keeps it in check is antibiotics. And when you take misuse or you take antibiotics, it can kill the good bacteria, which can cause the fungi to grow more than it should. So now you start experiencing vaginal yeast infection. So now other causes of vaginal yeast infection could be lowered immunity, because when you have a lower immunity, most times people that are having some chronic conditions such as maybe cancer or undergoing some radiotherapy treatment, chemotherapy treatment, or people that have immunocompromise, such as in the case of HIV or other chronic sicknesses, you may experience vaginal yeast infection. Sometimes this can be maybe the early sign of it, but not all, because it must be recurrent. Not when you have it once or twice. No, you must be having recurrent vaginal yeast infection, maybe 4 to 5 times in a year. So you know that something is wrong. Then you need to be checked. You need medical attention. So now I will be discussing the signs and symptoms of vaginal yeast infection. So I will be discussing the signs and symptoms of vaginal yeast infection. So what are the signs and symptoms of vaginal yeast infection? Vaginal yeast infection looks like any other, it can mimic, the signs and symptoms can mimic other infections, maybe urinary tract infection or other STIs. In the lab, they will not differentiate the type of organism that is causing the symptoms that you are experiencing. So now the most symptoms of vaginal yeast infection, number one is burning sensation. You feel that burning sensation in your vagina. Anytime after urinating, as if you feel the burning sensation, itching. You'll be having recurrent itching, your vagina will be itching you, even the vulva. You'll be having that, as if you should use your hand and scratch the hell out of your flesh, the itching sensation. That's another sign. Then another one is the redness of the vagina. The vagina area will be so reddish in color, it will be so reddish. The vulva area will be so reddish in color. You feel that place because of the activities of the organism. You start, that's what makes you to be having the burning sensation, the itching sensation, and sometimes swelling. The place can be swollen up because of the signs, the symptoms you are experiencing. Other symptoms include, after urinating, you still feel that burning sensation after urinating. Sometimes you feel that burning sensation. You have pain after sex, during sex, actually, painful sexual intercourse. You'll be experiencing a painful sexual intercourse. Then there are vaginal discharge that looks so, lumpy. You'll be experiencing some lumpy vaginal discharge. It's called cheese like, kind of, cheese like clumpy vaginal discharge. It's whitish, it's not brownish in color, but kind of comes out in clumps, kind of. So that's another thing you'll be experiencing. So now, I want to talk about the prevention of vaginal yeast infection. Yes, it can be prevented. Vaginal yeast infection is something that can be prevented with good hygiene. Yes, good personal hygiene can help you prevent vaginal yeast infection. Most times, if you have a poor hygiene, you may be experiencing yeast infection. Maybe the toilet you're using, the bathroom, and all that wearing. So here, prevention of vaginal yeast infection, you have to maintain a good personal hygiene. Yes, you have to maintain a good personal hygiene. Wear cotton pants. Stop wearing tight undies. Yes, tight undies can create room, for those yeast infections to start multiplying. So you remember that cotton is better than other nylon, because those other nylon materials can create, a moist environment for such organisms to, strive, and start, disturbing you. So now another thing is that you have to, if your clothes is wet, change it immediately. Change your clothes immediately. Change your undies. Maybe after swimming, you change it. You don't wear it for a long time. You change it. After swimming, you change it. Maintain a good personal hygiene. Like I said before, then eat well, eat healthy. Ensure you eat a well balanced diet. Drink water, eat healthy. It's very good. It's good for you. It's good for your vagina. So stop all these things that you insert in the vagina. Stop all those feminine wash, feminine scent, scented tampons, scented pads, douching. Stop it. Vagina is self-cleansing. Is self-cleansing, yes. Most times people, they tell me that they want to wash. What are you washing? What do you want to wash out? There is nothing to wash out. Vagina is self-cleansing. It cleans itself. That's how nature made it. Nature made it in such a way that it will cleanse itself. Just like you want to brush and brush inside your stomach. Can you brush your stomach? Or you want to put the toothbrush inside your esophagus. So many people, they while they are brushing, as if they should, brush down there. No, vagina is self-cleansing. So all you need to do is to ensure that you maintain a good personal hygiene. Even if you want to wash your vulva, the outer part of the vagina area. You use a mild soap, very mild soap, and wash it. You must not use the medicated soap you are using to bath to wash your vagina. No, I do advise people, don't use the medicated soap you're using to bath or other soap that you're using to bath to wash your vagina. If you must wash your vagina, your vulva area, not even the vagina, your vulva, the outer part of your vagina, those outer structures, it's called the vulva. So you just use a mild soap to wash it. So you prevent inserting anything. Some people say that they want the place to smell nice. Smell nice how? Vagina has its distinct smell. It has the odor. That's how nature made it. You must not put perfume. You must not put all those. So no, when you do that, you're destabilizing the pH, the vaginal pH. You're destabilizing it and it will make you prone to having yeast infection. So all those things are always discouraged. No doctor will ask you to wash your vagina. I've never seen a health personnel that will tell you to wash. No, because it's self-cleansing. It's self-cleansing. All you need is to, use a mild soap and wash the outer part. You don't need to insert your finger inside or insert your hand inside to bring out what? No. The body made it in such a way. God made the body in such a way that it's self-cleansing. That's why you have discharges. That's why all those things, it comes out on its own. And when you have infection, you see that the discharge you'll be experiencing will change. So now that we know the, prevention, as I've stated before, the prevention strategy is maintaining firstly a good personal hygiene. And if you discover that you're having recurrent vaginal yeast infection, it's good that you seek medical advice. Go and see your doctor, because most times you may have an underlying disease condition that may be predisposing you to having a recurrent vaginal yeast infection. So, what is now the cure? What is the cure of this vaginal yeast infection? What is the treatment? The treatment, because this yeast is caused by a fungi, it's fungi that causes this, yeast infection, which I said earlier that there in the vagina is just the normal flora. When there is an outgrowth of this, fungi, they start causing problem. So there are over the counter medication that can be given to you by your healthcare personnel. The doctor can prescribe nystatin, yeah. Sometimes you can, or fluconazole, any antifungi, cream or suppository can help you get rid of vaginal yeast infection most times. So it's good. It's not you just talk to your healthcare provider and they will recommend the one that is best for you. And if you're in doubt, maybe you don't know if it's really yeast infection, because most time, yeast infection is not really sexually transmitted. Yes, it's not really sexually transmitted, but not that your partner cannot get it. Maybe when you develop yeast infection or you have yeast infection, you can give it to your partner, but your partner may not be experiencing the symptom. And when after treating yourself, you meet your partner can reinfect you. So sometimes you can as well, you know, treat your partner too along while you're treating yourself. So this is all you have to discuss with your healthcare provider so that they will tell you the best treatment for you if you're going to involve your partner or not. So I believe with this my explanation, at least if you have any vaginal yeast infection, you know how to go about it. And apart from that, you have to maintain a good personal hygiene. Anything that triggers it, or you discover you have diabetes, your sugar is out of control, you're on birth control pills, you know that okay, maybe I should stop this or I should control my sugar. And if it's pregnancy related, of course, after 9 months, after giving birth, the whole thing will subside. So thank you for watching. Don't forget to like, share, and subscribe to my YouTube channel. My name is Nurse Valerie. Thank you for watching. Bye. See you next time.